How long should I wait after rhinoplasty to have Botox? Hi, I've recently had rhinoplasty away from home to reduce hump and bulbous bit and wanted to have Botox around my crow's feet and forehead while I'm here. Is 6 days post rhinoplasty too short a waiting period? Should I just wait it out and come back another time? I'm on day 2 post op now and very swollen around the eyes.
Thank you for your question. You submitted your question without a photo, and you're basically describing a situation where you're away from home, you've had a rhinoplasty where there was hump reduction as well as some tip surgery for a bulbous tip, and you are asking, is 6 days too early to get Botox for crow's feet lines and for forehead lines? And you are stating that you are now day 2 and that your eyes are fairly swollen. Well, I certainly can share with you how I would advise any patient who comes to me with a comparable situation and how I guide my patients who I operate on as to timing for an injectable procedure like Botox. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I belong to one of the first group of doctors to use Botox. I've been using it for my patients since 1993, and so I have a lot of experience in helping people with Botox. So, to answer your question, I would say that the better question to ask is this the optimal situation to get Botox? Now, the question of whether or not you can or cannot do something is dictated after a surgical procedure like you've undergone, and you state that you have significant swelling around your eyes. Well, Botox is not exactly, it's not really a filler, it's a neurotoxin. And what that means is that you need the toxin to be placed in a way that the nerves that go to the muscle that is causing the wrinkles to occur is effectively delivered. This is in contrast to a filler. So for example, if we use a filler like a hyaluronic acid filler to treat under-eye hollows or tear trough, well, that's in a if a person is swollen, then that procedure becomes difficult because you cannot really appreciate the contour improvements when there is swelling. So I would typically wait until some swelling related to whatever it was, whether it's surgery or whether it is or whether it's allergies or anything else, to get the optimal orientation. Now, when it comes to Botox, what I would be concerned about, let's start with just the crow's feet area since your eyes are swollen. I would be somewhat concerned about any dilution of the Botox in the area of swelling because the fluid and the dosage could interact in a way that you may not get the full benefit. It is certainly important to see how swollen you are at day 6. And more than likely, it probably would be safe enough to do as long as you don't have significant swelling. And in terms of the relative safety, the doses for Botox for the crow's feet line is relatively low, and therefore a problem with also migration, which is another issue of the Botox to another area, is relatively small. But if the Botox floats down to the muscles that are responsible for facial expression, it would not be, it's not, based on those, the dosages is not likely to be an issue. But again, you have to ask yourself, is it really worthwhile to have the possibility of either a diluted effect or a potential migration away from the target? When it comes to the forehead, I would suspect, again, that if you don't have much forehead swelling, then chances are you should probably be okay to do that. I think it'll be up to your doctor to ultimately decide if they are comfortable with doing the Botox for you. Sometimes it's really or most of the times I should say, it's really the clinical scenario that dictates when we do anything in this field, and understanding that if there's a lot of swelling or significant swelling, then it's suboptimal for whether it's a Botox or whether it's an injectable filler. You want to work with maximal predictability. I don't think there's really much of a lost opportunity if you are doing this at a place where you traveled for surgery to then come back to where you live and get the Botox procedure done more locally. So I hope that was helpful. I wish you the best of luck. Thank you for your question.